Elsewhere on the Tampa campus, some groundbreaking research is underway into Huntington's disease. It's a genetic disorder, and it can be devastating both to the patient and to the people who love and care for them. Hedel Gandhi introduces us to a couple dealing with this disease.
Vicki Owen fell in love with her husband Tom the minute she laid eyes on him on the dance floor. The couple got married 27 years ago, and they've been inseparable ever since.
He's got a great sense of humor. He's funny. He was funny. Still is.
Together, they enjoyed an active lifestyle. Tom was athletic and loved sports, including basketball, volleyball, and NASCAR.
I have stuff in the room, another room where I can tell you what I did with NASCAR driving experience. Unbelievable. Best thing I ever did.
But about 6 years ago, Vicki noticed a big change.
He was having difficulty focusing at work, remembering names, very short temper.
They came to see Dr. Juan Sanchez Ramos, a professor of neurology at USF, who diagnosed Tom with Huntington's disease.
I didn't like it. I didn't like it at all.
We were in shock because we had no idea what it was,
The genetic disorder causes nerve cells in the brain to break down over time. Huntington's patients have a 50% chance of passing it on to their children. It wasn't until after his diagnosis that Tom learned there were 16 people in his family with the disease.
When we started looking symptoms and things up about Huntington's online, it was really scary.
Cognitive decline, problems with thinking and concentration and planning ahead. Emotional issues, most commonly depression, but it could be mania, obsessive compulsive disorders. And thirdly, what it's well known for is the appearance of involuntary movements, dance-like movements known as chorea.
Dr. Sanchez Ramos is on the forefront of Huntington's research. He was part of the team that identified the gene that causes the disease back in 1993, and he's been searching for a cure ever since.
In simple words, is that we are designing a special vehicle, almost like a synthetic virus that we can load with the drug, put it into a nasal spray, and it can be delivered into the nose and transported from the nerve endings in the nose to the brain.
He's still testing the ability to use this nasal spray to deliver gene-silencing nanoparticles to the brain in mice. But so far, the research by the USF team is so impressive, the National Institute of Health awarded the team $2.3 million.
The grant really is designed to really work out the mechanism by which this works and work out little details like how much of the drug we need to load in each nanoparticle, how often do we have to administer it, how much of the drug actually gets into the brain, how does it distribute across the brain, and for how long is it silenced, how often do we have to administer this. So there's many questions that will be addressed over the next 5 years that will be instrumental for getting it to the next level, which would be a nasal spray for humans with Huntington's disease.
Since these particles need to be administered directly to the brain, the only other option out there right now is using a procedure similar to an epidural.
The safety and tolerability of a nasal spray compared to safety and tolerability of surgical procedures for delivering a drug is no comparison.
A non-invasive solution that is key, especially since researchers still don't know how often patients would need those treatments.
That his doctor is doing the research is just amazing. And to think that there's going to be a chance for him to either slow the progression or to get cured it's mind-boggling.
Hope for Vicki, Tom, and so many people affected by this heartbreaking disease.
Yeah, I do. I love Vicki. She's the confidant. She did everything. She takes care of me, So that's nice to have somebody that'll do that for you.
I love doing things for him. It's what is hard is that I have to do it, and that he can't do these things for himself any longer.
One of Tom's biggest struggles is swallowing. It's one of the reasons he's lost so much weight.
I get his medicine ready for him every day. I make sure he eats, and I have to find things that he can eat. He has difficulty eating anymore.
She's good about that. She really knows how to take care of me. She's found out what I like and don't like, and we have it going from there. I don't always eat it all, but I eat as much as I can.
Vicki misses the active lifestyle she once shared with Tom.
We wanted to do things, travel, and can't do it anymore.
She continues to help other families through a support group. She even wrote a chapter about her experience dealing with the disease. But Vicki still struggles with the burden of doing it all on her own.
I feel lonely. We don't have, friends here. We don't have family here.
But it's a lot of hardship on me and on my wife, Vicki. And I just think that we got to do something else. And I don't know what it is. I guess get tired of being tired.
Tom doesn't like to do much besides watching TV these days, and Vicki worries about him suffering from depression.
Worrying where our lives are going, where his life is going, finances, and I hate doing those. But I worry about everything because it's all on me now.
At times, they feel hopeless, but Dr. Sanchez Ramos tells Tom and all his patients that he's doing everything he can to stop this disease. An optimism that Vicki and Tom have to hold on to because it's all they've got. For University Beat, I'm Hedel Gandhi.